And on behalf of our principal investigator, Dr. Linda Goggin, and myself, welcome to the National Family Support Technical Assistance Center. This is our Office Hours running series, and today's topic is supporting organizational well-being and leader success through mentorship. I'm Gail Cormier, the project director of NFSTAC, the Family Center of Excellence, and we are led by the National Federation of Families. The monthly Office Hours series are designed with the family workforce in mind. This series is targeted for family-run executive leaders and emerging leaders. NFSTAC wishes to support all of our family workforce. In order to accomplish this, we will be hosting additional sets of series for other family support workforce staff as we continue along. So if you're an up-and-coming leader or a current leader, we welcome you. Before we start our interactive conversation today, I would like to go over a few housekeeping items. Today's conversation is being recorded. The recording with any additional resources will be uploaded to our NFSTAC website under the Events tab. If you have any technical difficulties, please type your comment and someone will be able to assist you. Please also type your questions for the presenter in the chat box. We'll be watching the chat during the entire presentation. And please, when we ask you to take off your mics, feel free to ask and talk and ask any questions you want. We want this to be very interactive. Our goal for office hours is to encourage a conversation between our guest presenters and all those in attendance. We encourage you to ask questions that will assist you in your daily work. We will unmute participants after the presentation portion is complete. If you can use the raise your hand button, that would be helpful. NFSTAC hopes you leave this event invigorated and with new ideas to help you do your work. We ask that you take time to complete a short feedback survey using the link provided at the end of the presentation. This survey will help us continuously improve our events, and it also fulfills our SAMHSA funding obligation to provide them with important data required by our contract. Please note, all information will be confidential and we will respect your privacy. We do not offer CEU credits for our events, but you will receive a certificate of attendance after the survey is completed. I would like to thank SAMHSA for allowing us to share this information with you today, and thank you all for joining us. At this time, I would like to introduce NFSTAC's project manager for this office hours series, Dana Asby. Dana?
Thanks, Gail. Thank you everyone for being here. And as Gail mentioned, we are going to have a conversation in the latter half of our hour together. And when we do have that conversation, we just want to remind you that we use family-centered language in all of the events that we do, and we ask that you do as well. So please try to make sure that your language is trauma responsive, strengths-based, avoids blaming caregivers, is inclusive, person first, respectful, non-judgmental, and consistent with our actions as family members, family peer specialists, and family-run organizations. So I wanted to just remind you or let you know, if this is your first time at one of our office hours this year, of what the goals of this particular series on supporting organizational well-being and leader success through mentorship are. So we want to support specifically executive directors and emerging leaders in family-run organizations using what we already know you do best, peer support. So that's going to come into play both during the conversations at the end of each office hour and during our mentor meetings between office hours. Another goal of this series is to increase your knowledge of leadership, management, and mentorship skills. And that comes into play with each of the experts that we bring into hear from each month. So this month, we're going to hear from Dr. Martha Staeheli about organizational well-being. Our third goal for this series is to really give you a roadmap towards organizational well-being so that you can not only enhance your staff's satisfaction with their job, but also enhance family engagement and help make your organization more sustainable. In part, we do that by providing a workbook to reflect on what you're going to learn here. In each office hour, not only are you going to get some new skills, strategies, and tools from those subject matter experts in a short 10 to 15-minute presentation towards the beginning of the hour, you'll also get some tips for mentorship itself between established leaders in the field and emerging leaders. And that happens on your own, one-on-one between the sessions. And if you need help finding a mentor, we ask that you go to NFSTAC.org and submit a technical assistance request, and we will match you up with someone that we think meets your needs. Another aspect of our office hour series is those peer discussions that we have, that we want to be the bulk of this time together about your own experience, what's working, and the challenges that you're having. And then you get the workbook at the end of each session, which is going to help you implement small steps each month so that by the time you reach the end of this series in May, you're going to have a clear picture of how to get to increased organizational well-being. And if you stick with us for 4 out of the 8 sessions, we're also going to give you 2 copies of Joan Gary's Nonprofit Leadership. So you can share that with someone that you'd like to mentor as well. So let's start today just by reminding ourselves what a mentor is. There's a great quote from Bob Proctor that says, "A mentor is someone who sees more talent and ability within you than you see in yourself and helps bring it out of you." So some of you might have connected with that mentor from our first session in October. You may have found someone, had a meeting, had some really productive conversations. Other of you might still be looking for a mentor, and that's okay. So we came up with this list of possible things that a mentor could help you with. Someone might be helping you facilitate your own personal and professional growth. A mentor might help you solve some specific problems that you're experiencing in your organization. They might also be sharing their experiences and giving you advice on some of those problems. Mentors can also teach you management skills and strategies. They can give you suggestions specific for your organization to grow and become sustainable. And oftentimes, a mentorship is a space for listening and empathy. So hopefully when you're out there looking for your mentor, connecting with your mentor, you're able to gain some of these things from that mentorship. We'd love to have some breakout rooms right now for you to have just 5 minutes to discuss in pairs what you are looking for in your mentorship. That might be growing professionally, performing your position better, making your organization sustainable, or someone to share your experiences and skills with being a mentor. You can talk about that if you haven't yet found that mentor that you're looking for. If you have found a mentor and you've had that first meeting or a mentee, then you could talk about how that first meeting went. So I'm just going to create breakout rooms really quickly. Again, just 2 people in each breakout room. And you go ahead in and we'll call you back in 5 minutes.
Hey, I was in the room with Teresa and we both just came in. So we didn't
Sorry
know
about that.
No, it just says 60 seconds, you're over, so it didn't matter.
We're gonna get started again. I know that was too short, it always is, but there's lots of time to talk as a whole group at the end of our time together. So if you are just coming back from the breakout room, if I can remind you to mute yourself during Martha's short presentation, that would be great. And I'm really excited to introduce Dr. Martha Staeheli. She is the director of the School Mental Health Initiative for the New England Mental Health Technology Transfer Center, which is an amazing resource. If you've never heard of them, make sure you visit them after Martha's presentation. Martha is a faculty member at the Program for Recovery and Community Health in the Yale School of Medicine, Department of Psychiatry. She's done some amazing research around substance use and mental health disorders, especially around health disparity and equity and under-resourced community, clinical, and educational environments. And I have been pleased to work with Martha around her work in school mental health. She has a wealth of knowledge about organizational well-being, and I am pleased to hand it over to her for the next 15 minutes.
Thank you so much, Dana, and thank you, Gail, and all of you who are here with us this afternoon. I'm so pleased to be with you. As Dana said, I'm Dr. Martha Staeheli, and I will just add to the brief bio that Dana read that I am also a family member and parent of people in recovery and people with lived experience of mental health conditions. So it's from that perspective, and also my perspective as both a researcher and as the leader of the School Mental Health Initiative for the New England MHTTC, that I have the pleasure of being able to talk to you today about caring for ourselves and others, organizational well-being. And I realize I'm only speaking for about 10 minutes, so there's a lot to cover in that time. And so while we won't be able to talk about all of it today, I hope that I'll be able to give you some ideas and directions for how you can think about your own organizations and your own leadership. All right, next slide. So today we are just going to talk briefly about what burnout is and organizational well-being as a strategy to prevent burnout in ourselves and in our colleagues. Leadership successes and challenges within those organizations, particularly now. And you will get a copy of the slides. I saw that question. So if I'm covering stuff quickly, you'll be able to go back to it. And then we're going to talk about how to increase well-being in staff and in the families with whom you work. So I want to just briefly start by defining what burnout is, because we hear this a lot in the media and in discussions with family members and colleagues. I'm so burned out. You're hearing that phrase a lot, especially now after the last couple of years. But really, burnout is an occupational phenomenon. Really, the formal definition has to do with work and our work lives. And according to the WHO, burnout is a syndrome that results from chronic workplace stress that hasn't been successfully managed. So the three main indicators of burnout are exhaustion, compassion fatigue, detachment, cynicism, or feeling useless, like your work isn't very important, like you're not making a difference, you have a reduced sense of accomplishment. So those are the three formal hallmarks of burnout at work. Signs of burnout. I'm sure that you can add many of your own to this, but as I mentioned, it can be that cynicism, that sort of gallows humor that we sometimes see, impatience or irritation, low energy, exhaustion, apathy, not being so interested, feeling like everything is an effort. Sometimes it could be physical symptoms or sleep changes or any sorts of changes in your well-being. So it may look different for you. I know for me, when I start getting easily irritated, that is usually a sign I need to take a rest. So it's important to begin this discussion thinking about what burnout might look like in your life, your particular symptoms. So what happens if we ignore burnout? There are a lot of things that happen within our personal lives and the way that burnout can affect our personal lives, but we're talking about our organizations and work lives today. So burnout can lead to decreased quality and performance, not being as productive as you used to, not being able to concentrate, less satisfaction and low morale, less compassion with for the people with whom you're working, and lots of employee turnover. Those are all warning signs that there may be something more systemic going on, this burnout phase that we're talking about, and that we're really seeing a lot of now. Sorry, Dana. I apologize. Next. Okay. So why is this happening now? Well, we all know that we're experiencing a lot more fatigue and exhaustion, but it's really important to think about that these things aren't happening in a vacuum. They're not just happening to us as individuals or because of our own abilities or our own limitations. There are all of these intersecting crises that have come together over the last couple of years, underlying personal factors, the difficulty of working within all of these big systems that are often broken or not functioning the way that they should. There's been a high both intensity and duration of trauma and secondary or tertiary trauma. When the people with whom we're working and the work that we're doing often has a lot of inherent baseline trauma. There's been a lot of helplessness and uncertainty. What is the future going to look like? Are we going to have enough? Are we going to have enough money, enough staff? Oh, I apologize. I don't know if you could hear that. I'm fostering a little dog who is wanting to join the conversation. There's the crises of trying to balance many different things at once. Many of us are in multiple roles, right, in our lives. And there's an issue of capacity when the needs that we're seeing and experiencing are overwhelming our resources. And all of this leads to trauma, stress, and burnout. But we have to think about ourselves experiencing those things happens in a broader context. So there are those individual wellness domains, the things like your physical health and your mental health, but that also occurs within a larger context where there are these organizational and systems wellness cultures. There are these cultural values and practices which we know are important and which sustain us. And there's sort of the societal and community wellness. So when we think about wellness, and we often have been talking about self-care, it's really important to expand that conversation to not only think about caring for the self, but caring for the systems, the organizations, and the communities within which we are living and working. All of that occurs together and in a very broad context. And there are some principles to keep in mind as we think about these things, and as we think about things like self-care or organizational wellness or well-being or health at work. There's an issue of equity and privilege. Not everybody experiences the trauma and the stresses in the same way. There are many groups within our society and our communities that are experiencing that more acutely or for a longer duration. And not everybody necessarily has the option to engage in self-care practices or to work within an organization that is attuned to those kinds of things. So when we're talking about this, we really have to think about equity and privilege. We have to think about the organizational influence. Some of us are leaders in organizations, and so we're able to have some control over the tone, but many of us are within organizations that have a particular way of doing things that may or may not facilitate well-being. But that organizational influence is really key to our well-being. We can't make individuals responsible for the difficulties and the stresses of organizations and systems. Culture counts. All different types of cultures, no matter where you come from, who you are, what your demographics are, what your organization culture is like, has an influence on both what the stresses are, but then all of the strengths and practices that we have within our cultures that help us mediate those stresses and prevent things like burnout. And it's important when you're thinking about your own organization or the people whom you serve to really have a cultural lens, to appreciate and to avail yourself of all of the strengths within various cultures that can contribute to wellness. There are lots of different perspectives on this material, on what wellness is, what it looks like for each of us. And we often have different abilities to engage in these sorts of things, different resources available to us, different things going on in our lives. So while there are lots of different ways to think about the perspectives, we can all be united in wanting to make these organizations better. And we have to make that a priority. So prioritizing wellness is really essential. And most of all, maybe fundamentally, it's important to have patience with ourselves, with our organizations, with our colleagues, and our clients, and those that we serve, because this takes a lot of practice, and it takes some persistence and patience. So what gets in the way of taking care of ourselves? We see a lot about it's really easy, just follow these 5 steps. Just do these things, you can feel better. What do we say? I'm too busy or tired. I don't have time for that. Other people need me more. I got to help them first. Then I will attend to my own wellness. I'll do it later when we have more energy, when we have more staff, when we have more money. I don't care anymore. I'm so past it. I don't have any energy for self-care or wellness. I just want to get the job done. My needs are so great that I don't even know where to begin. I don't know how. I don't even know how to start taking care of myself or taking care of my colleagues. Or this is something that I often hear, it's so self-indulgent. I have real work to do with people who really are suffering. It's too self-indulgent to engage in these sorts of practices. Or if I start doing that, if I need to take a day to myself, if I need to take a walk, people are going to think I'm lazy or not supporting my team or not getting my work done, or that I'm behaving badly or being self-indulgent. But what are we really saying with all of those messages? What's the underlying message? I'm less important than the people I care for. I don't really matter. And myself is not worth caring for. That's the message we're giving ourselves, that myself is not worth caring for. And I want us to really think about that message and think about, if we really believe that, how can we begin turning that on its head and deciding that we are worth caring for? So here are 10 ways to begin thinking about promoting resilience and well-being. These are obviously a lot more complex than 10 bullet points, but these are sort of the basics. It's about getting to know yourself, who you are, what you need, what you value. It's about taking care of the basics. Are you sleeping? Do you have time to eat? Do you have time to move? Are you treating yourself like you would treat your child or a loved one? Is your work working for you? What parts of your work are challenges? What parts are getting in the way? What parts are dragging you down, making you exhausted and burned out? What parts are sustaining you? Where and how have you been traumatized within your work? It's important to think about, we absorb so much trauma. How can we begin to address that and heal that? How can we address our stress? Using mindfulness practices, doing those sorts of self-care practices that we know are really important, taking a couple moments to breathe, to move, to sit and think. What are we grieving? This is really important, especially now. And we're in a culture that often doesn't acknowledge and honor the grief that we have. And we certainly have had both collective griefs in the last couple of years and individual griefs that deserve some time and space to process. We have to think about cultivating connection with others. Like this wonderful mentorship that Dana and Gail were talking about earlier is a way to connect with others, to feed ourselves, to both give and receive care and compassion. We have to find ways to regain some sense of control. Often in our work lives, when things seem out of control and there's always another urgent need, it's important to think about the places where we can regain a sense of control. And we have to think about our strengths as an organization, our strengths as leaders, or as colleagues. We have to begin with a strengths perspective to really think about what can we bring to this issue from our cultures, our lives, our strengths, our work, our colleagues, and our clients. And at the end of the day, sometimes we just need to rest and we need to say no. And that's something that we often have a very difficult time with, especially in peer work, especially within family systems. It can be very difficult to say no and to set boundaries, but that's an important part of honoring yourself and your own needs, and also being a good role model for the people you're serving and working with. So what can you do? The first thing you can do is pay attention to what's going on. So if our heads have been down and we've been focused on our work, how can we begin to pay attention to what is happening in our organizations, where the challenges are, where the strengths are? How can we create supportive and open environments and increase access to self-care, to wellness, to time? How can we begin to listen to people's needs with compassion, even when we're feeling rushed and stressed and stretched ourselves? What are our organization's protocols? What are their protocols around taking time off, ending the workday and not working on weekends, for example, taking vacation time? What does your EAP look like? What is your role? Knowing what you're responsible for and what you're not responsible for is important. And that's an important part of leadership, is knowing where the boundaries are of what you can do and what needs to be left to somebody else to pick up. It's important to know who the clinical, formal, and informal supports are. Other community organizations that you can partner with, experts or consultants you can bring in, people with lived experience to help guide the way, mentors, formal mental health supports, things like therapy and getting group therapy, and creating a culture where that is not only okay, but encouraged and part of the fabric of your organizational culture. It's important to get training and education about the issues that you're wrestling with. As Gail says, it's important to take your lunch and your PTO and your time. It's important to stick by that and to set that as not only a goal for yourself, but as being a role model for the people in your organization. Taking care of your own mental health, making that experience explicit to the people around you. You know, I'm really stressed. I need to take the afternoon off to just decompress from this. Those are important things that you can say to signal to people that this is okay. So we have to think about what factors influence our mental health and help us gain that resilience. Social connection, relationships, healthy food, movement, exercise, positive experiences, chances to connect with people, having your genetic predisposition, having access to care and support and medical care, financial resources, mindfulness, satisfaction, finding satisfaction where you can, conscientiousness about taking care of yourself, your health, and your well-being, and not forgetting how important joy and fun is in fostering and building your resilience. And there may be other things that help you take care of your mental health. So there are just 5 questions to ask yourself as you're thinking about your work. What is within my control and what isn't? Am I willing to make a change, whether large or small? Am I focusing on solution and strength, or am I stuck in the problems and the barriers? Is this something I need help with? Do I need somebody else to help me figure this out, or to put these sorts of practices, implement them? And am I caring for myself the way I would someone I love? Which I know is a question that is very near and dear to my heart, and I know probably to all of you as well, particularly in the work that you do with families. So I know that's very brief, but I want to leave you with this quote by Maya Angelou: as soon as healing takes place, go out and heal somebody else. But remember that it has to take place for you first. So with that, I'm going to hand it back to Gail. Thank you so much. And I agree that nature is so healing, and that I myself, if I don't spend enough time in nature, I get really irritable. So I agree with that.
Yes, actually, every day I take a walk out in nature for that very reason. So I agree. Let me just change my screen, because I just got pushed out of my, while you were speaking, I got bumped out of our Zoom room. So sorry about that. Again, we want this to be very interactive. And as I ask Martha a couple of questions, I would love you to start thinking about how you too would answer these. And Martha, first of all, how can leaders who feel like they already don't have time to improve organizational well-being without feeling like they are just putting one more thing on their plate? So how do they do this when they're already overwhelmed with their own well-being? How do they handle improving organizational well-being?
This is the question, right? I love this question because it is the root, and it's probably what all of you are thinking. Great, I'm already overloaded. And the phrase that comes to mind is start small to go big. It can be overwhelming, like, okay, now I'm gonna implement organizational wellness practices, change all of our policies, change how our PTO is structured, change pay, all of those kinds of things. It's overwhelming. You don't have to do all of them today. You don't have to do all of them this year. You can begin with something small. You can begin with one small change just in yourself. The foot in the door technique, right? You know what? I don't get outside during my workday, but I can take one lap around the block. And I promise you'll come back and feel better. Your perspective will change. So do something small and then talk about it. Start talking about these things. If you're the leader of an organization, you don't have to do this all by yourself, and you shouldn't. You can enlist the people around you in partnership to come up with what would make the day better. Is it having tea in the break room when there hasn't been? Is it taking lunch where everybody breaks for lunch and nobody schedules meetings? Is it having a group, a party, a potluck? Start small. You don't have to do everything all at once, and you can't. You can take a deep breath. You have time to take 3 deep breaths in the next 5 minutes. You're breathing anyway. Breathe a little deeper and see how that feels. And take some pressure off of yourself. We all got into this together. We all have to get out of it together.
What wonderful advice. And I see that Jill wrote that some of our family members contact me so stressed that she often says to start their time by taking deep breaths. We have a lot of family peer specialists that are in here listening, planning on how they get stronger in their positions and move up the ladder. And as they do, they may not be the executive directors. So they may not be the person who has that deep control in organizational well-being. So here's the question I have. What are the strengths of the family peer specialists that will make combating burnout easier in their position?
I think that family members who have spent often years and years caring for others, navigating systems, negotiating really, really difficult challenges, have a lot of knowledge and information about how to make this work. And we can look to them, we can look within ourselves in a difficult family situation. How did I make it through? What made it better? I have a technique, I can breathe, I can share that with somebody else, and they can share it with somebody else. None of us made it through the difficulties of caring for our families without the help of somebody else and without knowledge that is passed from one of us to the other. That's the whole basis upon which peer support rests, right? So our family peer specialists have a lot of knowledge and information about how to get through tough times, right? You've all successfully made it through tough times, 100% of you on 100% of the days. How did you do that? And what was the one thing that, say, another mother said to you? I'll tell you mine was, You don't have to live your child's life all today. Just a little bit of space. I don't have to do it all today. Those kinds of things. Those who have been before us have that information, have that knowledge about how to move forward through difficult times. And you don't have to be the leader and have control, perfect control over your organization. Having Jill's suggestion of just starting a phone call, a meeting, a conference with just a couple deep breaths, a glass of water makes a huge difference. It's a start, and it's all of those things add up.
Thank you very much. We have a couple of questions now as an open discussion, so I would love to encourage everybody to put on your cameras and take off your mics so we can hear you. Feel free to write in the chat, but we'd love to hear you too. And why don't you, Dana, if it's okay, can you take us off pin? And here's the questions. I would love to hear from everyone. How would you rate the organizational well-being of your workplace, of the current place you're at? Now, this is very important as we grow in your own position. You have to take in account what's going on in your own job. So how's your organizational well-being at your workplace? Let's think about that first, because I'm going to ask you too to start thinking about how to improve it. Even at you may think you're at a level that you don't have any power to, but I bet we all do. So who would like to go first?
I'll go first. Excuse me. I just switched positions in October, and now I'm working at NAMI, New Hampshire, and it has made a world of difference being here, and just the incredible support in the community that I work in. It's really amazing. And I had taken a leave to support my own household through some tough times, and what I didn't realize at the time was that I wasn't just leaving for my family, but leaving for myself. And now being on the other side of it, I realize how powerful it is to be in a place where you feel respected and empowered and supported.
Oh, that's excellent. That really is. Anybody else?
I'll go,
I just
Gail.
want to
This is
point.
Corey.
Oh, I'm sorry.
Okay, Corey, go ahead, and then we'll go to the next one. Go ahead, Corey.
Okay, and I'm sorry, I'm in my car driving, so I can't be on camera. But I feel the same. Being in a new position is very stressful, but I feel like for a long time, once we hit one bump, we was bracing for another. I am hopeful that we are getting to a point now. It feels like I can breathe. But knowing that I have support from others and feeling free enough to ask questions has really made a world of difference. So I'm very thankful for, like she said before, the people that came before me that helped me when I call at the drop of a dime, Gail included, and say, help me, what do I do? Having that support is just wonderful. So
That's a good example, Corey. And Corey actually has, in full disclosure, my former job. So sometimes Corey will call me, and sometimes I'll talk to her. We act as listening boards to support each other. So that's a really wonderful thing. I see that, I think I saw someone said they also, Peaches. I recently left a position where the organizational well-being is very poor. My new organization, the well-being is much better, even though there is so much more work. I think that is a really good point. And I think, Martha, you may agree with me. Sometimes you can have a ton of work, but if you have a healthy organization and people are all working as a team and working in a positive way, even though the work might be stressful, you know that's only temporary and you can get through it. When you have a very poor organizational well-being and everybody's stressed and hates it there, and there's a lack of leadership, that's where you see people getting sick, both physically and mentally. So I agree there. I had someone that jumped in with Corey, and that would be the next person, but I don't know who it is. All right, does anyone else want to go?
Yeah, I would like to say something. Can y'all hear me?
Yeah, I can, Benita.
All right. No, I'm sorry, my camera is off. I actually woke up 10 minutes before this started. So yeah, my hair's not done. That's the reason why my camera not on. But anyway, what I want to say is this: that she I like the fact that she said I'm a family member first. And then she was talking, even though we was talking about organization, I was thinking like as a mother too, how many times I put people before me, my children, my brothers, my mom, my family. I love my family. If you do anything, I drop up at a drop of the dime, no matter how I'm feeling. And I tend to do that, I wear many hats, and I'm thinking like during the whole presentation while she was presenting, how much I give of myself, whether I'm at my regular job, or I'm a chaplain, being a chaplain, or just being a mother. A lot of times we don't realize when we overextend ourselves, and we have to learn when to say no. And it's not no to be mean, it's no because I need just 5 minutes to myself. I
Mhm.
need that time for just me to be Benita, so I could debrief, so I could breathe, so I could woosah. This time of year is very busy for me. I have a accounting degree too, so I'm about to these next 4 months. I'm gonna be working as an accountant. I got my city job. I'm also a chaplain. I got all these hats. I'm somebody's mother, but I need to learn how to be able to say, Benita, you know what? You could take a day off and sleep all day.
Well, but
Literally.
Benita, that's excellent advice. One last thought on this question. Does anyone have any last thought?
Yeah, this is Tammy. I have one thought. When I was listening about the organizational structure, I have a small nonprofit, but I remember when I worked in child welfare and I wore different hats too. And the key thing that I feel like I want to say is about the balance, to be able to balance and know when it's time to do that self-care, or take a break. And like the young ladies just said, I need to sleep for the day. Is key to what I had to learn and what I'm bringing to my family run organizations with being able to work with other peers and families, is, just being able to have a balance in everything that we do.
Excellent. Yes. And
Could I
now,
add something?
sure.
Hi, my name is Shirley Kane, and I apologize for not being on camera. I have a new computer and the camera quit working for now. So,
No problem.
but I can talk and I have audio, so I'm grateful for that. One thing I just wanted to point out, I know of so many organizations where a lot of you are doing so much work for your communities, and bless you for all that work that you do. Because I just got off another meeting with one of my grantees, and she's from the Nez Perce tribe, and they have just like an unbelievable amount of deaths right now in their communities. So they're dealing with grief. And I think what we forget about is we forget about those workers that do this boots on the ground kind of work for their communities. And then they don't realize a lot of times they have that secondary trauma, because of the situations. Because I'm a former tribal judge, and sometimes we had horrific situations where, like when children die, especially, it's so hard to deal with that as an agency. And so I think we need to have more programming for our workers, so our workers can do self-care on the job and do debriefing. And then like I even wanted like a massage therapist to come and help the staff, to give them that time so they could start that process for self-healing, because there's so much that they're dealing with in the communities. So I just wanted to add that. And I'm so grateful for all of you, for all the work that you're doing. Thank you.
I am so grateful. You have some great ideas. And I want everybody really to think about this. We're here in office hours, not only to help the people we support, but also to help each other grow in our positions, to move up the ladder. So this is a real office hours, a work-centric series. So think about how we could do this for our peers, our work peers, not the families we're supporting. Deborah, I see your hand is up. Do you have a
Yes, and I
thought?
do. Yes, ma'am. I do want to apologize for being late, but my granddaughter got suspended. I had to have a meeting with her psychiatrist, but it's all good because this is one of my philosophies. Everything happened for a reason. And one of my peers are on here, and that is Teresa. I called Teresa on my way to pick her up and said, Teresa, what should I do about this 504? I have a nonprofit for grandparents raising grandchildren. She's my granddaughter. And I just want to say that I had toxic, I wasn't diagnosed with toxic stress, but I know it is now because I was helping a grandfather to get rental assistance here in Atlanta. It was so hard, and he was about to get evicted. I went to bed every night with that in my brain. All of a sudden, one day it hit me. I had no energy. I didn't have a cold. I had a COVID test. I had flu test. I had it all. They said it's nothing wrong. And then I told my husband, I said, you know what it is? It's toxic stress. I said, because you take this with you. If you're a case manager or even with us with nonprofit and serving our population or our community, everything goes to bed with us. I done had a truckload of food today that I picked up for my grandparents. After that, I get a call. My granddaughter got suspended. I run back home. I got to get on a call with the psychiatrist. And now, boom, I'm on this with you all. And I just happen to see it. Oh my God, I missed it. But I just want to say, we're all are blessings, but please let us take better care. And I heard Benita saying that we really do, and I have a problem with that. I'll tell you that right now.
Deborah, excellent thoughts. Martha, I see that your hand's up.
I just wanted to say, in response to these wonderful questions and comments and thoughts, and particularly to the idea that we have seen in our work and our own lives some horrendous, heartbreaking things, particularly now, but over the course of many years. Sometimes the work needs to stop, and we need to stop doing the work, because the work is us, the work is the people, and we have to stop thinking about productivity, and we have to start just honoring the fact that we are heartbroken and exhausted, and that we need some time to cry together, be together, and the work will find the work. The work will find us again, but work is not life. We're life. So
Thank you, Martha. And this is such a dynamic conversation, and I never like to stop. But I want you all to think to yourself, and I can't ask this question out loud, but I do want you to think about the question. What is one possible strategy that Dr. Staeheli discussed today that you might want to implement into your organization? Start thinking about this, because I'm going to turn it over to Dana, and she's going to talk about the workbook we have, and you can put your thoughts in the workbook. Dana?
Thank you so much, Gail. So we do want to offer you support between these office hour sessions. Part of that is leaving with you with some really manageable action steps to take all the information you gain today and start to put it into practice in your organizations. So we're asking you to take 3 action steps between now and our January office hour. The first is to rate the organizational well-being of your workplace and identify areas of potential growth. So in our workbook, I've linked a formal organizational well-being. Sorry about that. I've linked a formal organizational well-being assessment that you could take. You can also just do a little Google search to find several other variations of that, but you can also just start to list positive aspects of well-being and areas of growth as well. Another thing that we're asking you to do this month is to identify a few strategies to reduce staff and your own personal burnout and compassion fatigue, because we know, as Martha discussed, that we as leaders are models for the rest of our staff. If we're overworking ourselves, constantly getting sick, not taking care of our well-being, our staff get the message that this is the culture of this workplace, and this is just how we have to operate. So I've got lots of different resources in addition to all the wonderful strategies that Martha and you yourselves shared today. There are lots of other articles and other videos and guidebooks about organizational well-being that are linked in the workbook that you're going to receive in the follow-up email, along with this slideshow. And then your third action step is to just meet with your mentor or mentee. And a reminder for those that missed the beginning of the hour, if you haven't already found a mentor or a mentee, if you're looking to share your knowledge, make sure to visit NFSTAC.org and do a technical assistance request so that we can pair you up with somebody. When you get this slideshow, there will be a link to our workbook, just a really brief share of what that looks like. If you came to our October one, you'll see the same information at the top of the workbook, including a little bit of information about how the discussions might be formatted. Then we're going to get down to the discussion guide. This gets updated each month. If you missed our first office hour and you're starting from scratch with your mentor, maybe you could schedule a couple of meetings in the next month and go over some of the groundwork about laying down the logistics and getting to know each other in the mentorship. And then we've added some new stuff around December's topic of organizational well-being, some discussion points that you might have. Of course, you don't have to only talk about this. You can talk about more. If this is not going to serve you, throw that out the window and talk about whatever it is that you need. And then you'll see our action steps down here and a little bit of room to take some notes for yourself. And if you scroll all the way down to the bottom of the workbook, you'll see the resources. October's resources were all about mentorship. So check those out if you didn't already. And then we've got just a wealth of things around organizational well-being in there. So please make sure to click that link and find the workbook, and you'll get that in an email as well. We also want to make sure that you know what our next topic is. We're really excited to be talking about coaching and training the family peer workforce. We've got two amazing speakers who are going to be joining us. Sean Perry, who's the founder and president of We Are Hope, is going to be talking about the importance of coaching to make sure that all of the wonderful professional development we require of our staff gets implemented in the highest quality possible. We also have Amanda Hawkins, who's the program director for Child and Family Services, a private nonprofit in Hawaii, who's going to talk about what they require of their family peer specialists for training and the new hire orientation that they use to help introduce their staff to their organizational culture. So there's a link to register for all the office hours there. And we also have our contact information there, including Martha's email and the websites to Yale Perch and the Mental Health Technology Transfer Center. Please visit that web link if you can. There are just so many great resources for behavioral health providers in there, which peers are definitely a part of. Last, but definitely not least, SAMHSA does require us to evaluate our services. This really helps make sure that we get to have this free programming for people. So please pull out your cell phone and take a picture of that QR code to get to our really, really brief survey, or follow the link that's going to be sent to you in the follow-up email. You're also going to go ahead and get that link popped right up as soon as you exit this webinar. So follow that link, and that's how you're going to get your certificate of attendance. When you get that link to the certificate of attendance, it's going to ask you to download the certificate, and you can enter in your name. If you have any issues with any of those processes, just go ahead and email me, and I'll make sure to get you on your way. Thank you, thank you, thank you. And we hope to see you again next month in January. Have a wonderful holiday season, and we will see you soon.
Thank you, everybody.
Happy holidays.
Holiday, everyone.
Happy holidays.
Happy holidays.
Thank you.